In the first half of 2024, Redbridge Rainbow Community researched LGBTQ plus people's experiences of health and care services, as well as gathered the perspectives of people working in health and care. This project was kindly supported by a community cash grant from Healthwatch Redbridge. We've now published a short report with our findings, as well as resources and tips for local services. So I'll just briefly talk through just some of the key services and those resources that we have made available. So people recognise that health and care services are under a lot of pressure. We also wanted to recognise some of their positive experiences listed here on the left, but we did also hear about less positive experiences related to a whole load of issues, but a lot of those did chime with what is known in terms of other research into LGBTQ plus people's experiences of health and care services. So in particular, people did talk about assumptions and misconceptions about them, people assuming partner might be a friend or a sibling, and also people assuming that someone might be heterosexual based on how they present, and people having to continually and regularly come out to services, um, which can be challenging. But it was interesting to note that some respondents felt that some departments were much more comfortable, more open, and appeared to be more understanding about LGBTQ plus people and diverse identities. So I think the real opportunity is for all departments to learn from those departments where people felt they had a slightly better experience. And then a couple of other issues were raised, in particular around future-proofing care. Increasingly, LGBTQ plus people are living openly as LGBTQ plus people, and so people were wondering whether care services have really caught up with that and whether they're ready to support and welcome LGBTQ plus people. People also raised some concerns about local communications and actions around issues like MPOX, which affected a particular subset or subsets of the LGBTQ plus community. And while there was action across London, some people felt there could have been some level of local communications and around issues like MPOX to really show that local services were there for people as well. And then in terms of people working in health and care, we did have relatively high levels of confidence working particularly with people with diverse sexual orientations, less so around people with diverse gender identities. But it is important to recognise that the survey we ran was self-selecting, so it shouldn't be seen as a representative study of what's going on with health and care workers locally. And confidence is great. We also know that overconfidence can be an issue, so we really encourage all professionals to reflect and think if they have perhaps made mistakes in the past and how they could avoid those mistakes in the future, as well as thinking about how you deal with mistakes. So people, yes, told us that they felt generally quite comfortable working with gay, lesbian, bi people, but there was a gap in terms of people's understanding of asexual people and how to work with them. There was less confidence around working with gender fluid people, trans people, non-binary people. Couple of questions around how to use pronouns correctly. But a really positive point on in the bottom right there about people recognizing that they might not always get everything right, but they do know that if you don't get something right, recognize that, apologize, seek clarification if needed, and move on just to help the person feel more comfortable. And in terms of the kind of support that people would like who are working in health and care, they thought they'd like more support about how to talk to people to make sure people are feel comfortable to be open about their LGBTQ plus identity, and that might particularly include older people. People wanted to see leadership from their trust, from their organization, as well as having some specific training on specific issues such as language. Also, people wanted to see a range of interventions so that it's perhaps not just a one-off meeting during Pride Month or other key dates in our calendar, but regular training, workplace talks, sharing feedback from LGBTQ plus patients or service users, as well as articles, blogs, and having also inclusive policies and perhaps being part of programs such as Diversity Champions or Pride in Practice to check and improve practice. So in terms of the resources we've got in the report, we've got just 4 key questions with some additional information in the report. People to and services to take stock of what they're doing so far, recognize that, which is of course really important. Also explore other ways they might be able to find out about the experiences of LGBTQ plus people, any specific issues they might need to address, how they can go about increasing staff knowledge and skills, and importantly, confidence, and how to ensure there's consistent and clear visibility of LGBTQ plus inclusion as well as zero tolerance uh, messages as well. Then we've also got some top tips for working with LGBTQ plus people that came through our interviews with LGBTQ plus people, and as well as a glossary of some of the main terms that come up and people did ask about as the survey and our other work, and we link to more exhaustive glossaries as well. So if you'd like to find out more, please download the report on our website and do get in touch if you'd like to discuss any of the findings as well as any action that you're planning in the future. We'd be really happy to talk to you.